and so she's at risk for having her nipple die. She has a higher risk than the average patient. There's a lot of surgeons that would just actually completely remove her nipple and put it back on as a skin graft.
Now, you probably don't know this, but my first TV appearance ever was on Dr. 90210.
Tony Yoon is the newest fellow in the program. I'd love to keep him with me, but unfortunately he's going to go back to Detroit.
It's amazing how taking out just little pieces or changing little pieces of cartilage can make such a big difference in the nose.
So it holds a very special place for me. So I'm really excited to react to the newest season of Dr. 90210 with brand new doctors.
My name is Carlina Lee. I'm 26 years old, and my boobs keep growing and growing and growing, and they're never gonna stop. I really want them smaller.
As a plastic surgeon who does a lot of breast surgery, it seems like every week I'm making breasts bigger, I'm making them smaller, or I'm lifting them. In general, it's not common for breasts to get bigger and bigger and bigger after you go through adolescence. But every once in a while, I hear from a patient where this happens to them. Now, the craziest story of this happening was a patient that I used to have who was a former topless model, and she was really famous and decided that she wanted to go out of the business. So she reduced her J-cup breasts down to a D-cup, and over the ensuing 6 to 12 months, her breasts spontaneously re-enlarged back to a J-cup. Even though she wanted to get out of the business, her breasts didn't.
When I was in 6th grade, I used to get teased for my boobs, and I was the girl that had the biggest boobs in middle school. But then like in high school, I kind of got popular as the big boob girl.
I'm sure you know that the breasts change shape as you get older. When you're younger, typically the majority of your breast is made out of thick, firm breast tissue. It literally has the consistency of styrofoam. But as you get older, and especially after having children, the breast starts to change what it is made out of. It becomes mostly fat. Well, unfortunately, fat doesn't feel firm and it doesn't hold up very well, and that's why women's breasts tend to droop as they get older.
So I understand you're here today to talk about a breast reduction.
Yes, I had a baby a year ago.
Congratulations.
And so before I had him, I was an H cup.
Okay.
You know? So they were like super perky and like lovable, you know? But now they've grown like 6 or 7 cup sizes, and they're still growing. I hate them.
So when I see patients like this, a couple things enter my mind. The first thing is they're still growing. So could that be that maybe the patient is gaining weight? If somebody gains weight, then the amount of fat in their body increases, and because part of the breast is made up of fat, the breast can get bigger as well. The other thing that we always have to be aware of is because 1 in 9 women get breast cancer through their lifetime is a change in the breast due to something more nefarious, something more dangerous like a mass. That usually doesn't happen on both sides, but that is something that always should be on the mind of a plastic surgeon.
Are you having any pain in your back and your neck?
Sharp pains in my back.
Yeah.
I can't sleep because I have to pull my boobs in 2 different directions. I can't work out because they jiggle too much. And I'm at a point in my life where it's just hurting too much.
Patients who undergo breast reduction surgeries are some of the happiest patients that we see in plastic surgery. And that's because not only are we reducing the size of the breasts and we're giving the patient a nicer shape, hopefully, but quite often women who have breasts that are so large and so heavy have these types of symptoms like back, neck, and shoulder pain. And I find that in a lot of them, once you do the surgery, they wake up in the recovery room and the pain is gone. And for some people, it can be absolutely life-changing.
Believe it or not, there's like kind of an ideal place for the nipple, right where your crease is, which is going to be somewhere up here, or about mid-humerus.
The location of the nipple with this surgery is so incredibly important because if the nipple is too high, the breast can get what we call a bottomed out look, where it looks like the nipple is pointing upward. Obviously, if the nipple is too low, then the patient still feels droopy. The big thing you have to realize with breast reduction surgery is that it creates a lot of scars in order to get you where you want to be. And those scars typically extend circularly around the areola. It goes vertically down and underneath the breast.
This will be the biggest breast reduction I've ever done, and I do a lot of breast reductions. My main goal is to get Carlina down to the size she wants, and most importantly, eliminate all of these symptoms she has from these excessively large breasts. And I really hope I can make her happy.
When patients have breasts that are this large and this long, the the blood supply to the nipple during this operation can be problematic. Because the distance between the chest and the nipple is so long in this situation, she is at very high risk of the nipple not surviving this operation. And if it doesn't survive, it literally turns black and it falls off. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
I'm really excited to get the surgery, not only for my pain, but to get back to the old me.
Hi, good morning. Are you ready for this?
Yes.
So let's do a breast reduction. Underneath, a lot of boob. Not for much longer. Okay, so this is actually going to be where your nipple is going to live.
Wow.
So it has a long way to travel. That's going to be a nice, normal position.
I mentioned to you earlier that because her breasts are so long and so large, she is at risk of her nipple not surviving the surgery. In certain cases, when the breast is so long like that and the risk is high, sometimes we'll actually take the nipple off and put it on as a skin graft. The problem with the free nipple graft is often it doesn't have sensation like a regular nipple, and there's a risk that that nipple graft may not take and that nipple can actually slough off and you start back over again. In that situation, then, she would have a breast that has been reduced successfully, but with no nipples.
Carlina's nipple to crease distance and nipple to notch distance are quite long, and so she's at risk for having her nipple die. She has a higher risk than the average patient. There's a lot of surgeons that would just actually completely remove her nipple and put it back on as a skin graft. We're gonna try not to do that with Carlina, but it's certainly more complicated.
I have done breast reductions like Carlina's here, breasts that are so incredibly large and have been able to keep the nipple surviving. But the key is to leave enough tissue attached to the breast so that there's enough blood supply to supply that nipple. The only main issue with that is sometimes you can end up with the breast a bit larger than you may ideally want.
Okay, let's start with the 15 blade. For Carlina's breast reduction, I will remove the excess skin and breast tissue, lift and reconstruct the breast, and then resize her nipple. We're gonna make her areola a little over 4 centimeters in diameter. Her natural areola is about 13 centimeters in diameter, so this is gonna be a lot smaller. Okay, so here's our first clump. Now I'm just going to kind of separate the island of tissue that her nipple lives on from the breast that I'm going to remove.
As you can see, this is a very involved operation. Essentially, in the middle of a breast reduction, it looks like there was a bomb that's put inside the breast and it exploded the breast open. This is how we do it. We actually take the breast apart, remove the excess tissue on the inside, and then put it back together again.
Her areola looks great. So now I'm going to remove all of this extra breast tissue. That is still an enormous boob, you know? We just finished one side of Carlina and we've removed a little bit over 5 pounds of breast and fatty tissue.
So they've removed around 5 pounds of extra tissue from the one breast. Most insurance companies, to pay for a breast reduction, require about 1 pound to be removed from each side. So they've removed literally 5 times what is often done in a traditional breast reduction.
It's still like the biggest boob I've ever seen. I'm gonna go re-scrub real quick. You start seeing it come together. We're gonna obviously have to take much more off the lower portion of her breast. Once we finish the other side, it'll be a little over 10 pounds total of breast tissue that we've now removed.
This is a pretty tedious operation. Now, a breast reduction surgery of this magnitude, at least in my hands, is about a 4-hour operation. And it takes a lot of time because what you're trying to do is match one side up to the other. And so that necessitates lying the patient down in the operating room, sitting her back up, lying her down, sitting her back up, trying to match things up right to remove just the right amount of skin and extra tissue to get the best result possible.
I'm so excited to see Dr. Kelly. I definitely went into like a little depression at first.
The booby blues.
Yeah,
Yes.
because from 13, I've had big boobs. So it's been like half my life. And then, I get this dramatic surgery.
The booby blues is real, and it hits pretty much every woman.
Yeah.
I think for you, it would be even worse than the average because you
Yeah.
had such a drastic change.
I'm better now, so I'm
Yeah.
healthier. I'm in a good mindset.
I love it. That's good to hear.
So I've never heard this called the booby blues before, but it is very common after any plastic surgery for patients to get buyer's remorse because they look at their body, they look at their face, they look at their breasts, even sometimes their tummy, and they go, geez, did I do the right thing? Especially when they're swollen, they're bruised, they're recovering. I see it all the time with these types of operations. But the key is to hold on, hang tight, give it time, allow your body to heal, and allow yourself to get used to these new results.
When I first met Carlina, she had absolutely enormous breasts. Too big, too low, back pain, neck pain. When I saw Carlina today, it was a different person. Her breasts fit her body now. The shape is pretty. They're higher on her chest where they belong.
That looks like a really nice result. Now, if you look really closely, you can see some asymmetry. That right breast sitting a little bit lower than the left. These are things that unfortunately happen even with a really good result.
Before, my boobs were an M. They were heavy and they hurt my neck a lot. But now I'm an F, as in fine, and they are perky and it's lighter on my chest and my shoulders. And now I can carry my baby without feeling like I'm carrying 3 kids at once. I just feel comfortable.
I mentioned earlier that patients who undergo breast reductions are some of our happiest patients. As long as they're okay with the scars and they heal well, typically patients are super, super happy. So that is an example of a surgery that has gone really well on Dr. 90210. But what about operations that don't go so well? What about operations that get botched? Well, take a peek at the playlist I have right up here where I react to numerous episodes of Botched. And these are patients who have issues that will blow your mind. Take a peek at it right up here. And remember, eat real food, use clean skincare, and always consider actual plastic surgery as a last resort.